I think it's really important, and I think employers do have a duty of care to accommodate and try to destigmatise these conversations. We don't want to live in that kind of society where people have to ask permission to go to the loo.
Hello, Kathy here. September is Urology Awareness Month. And to mark the occasion this week, we're talking about all things pee related. Yes, you heard that right, pee. We all do it, but how much do we know about how it can affect us at work? In a world we often shy away from discussing certain health topics, Urology Awareness Month encourages us to break that silence. From common conditions like urinary tract infections to more complex issues and personal issues like bladder cancer. Urology health affects everybody, and yes, it has an effect in the workplace too. So I'm thrilled that today Helen Lake is joining me, urology lead specialist at PEPI, and with over 3 decades of experience in men's health and urology, she brings invaluable insights to us today. And together we're going to shed some light on urology in the workplace, help us understand why it's time to stop overlooking them. Helen, can you just give us a bit of an introduction to yourself, please, and some background to the world of urology?
Thanks, Kathy. Yes, I'm delighted to be here. So yes, I started my urology career, my nursing career, as a staff nurse in the NHS on a busy urology ward. And I didn't really know much about it at the time, but, I was fascinated and very interested straight away, because what I found was that urology issues affect men and women, all genders and all ages, from really sort of your teens up until post-retirement. And so it was very varied, and I immediately became hooked, really. So from there, I went on to be a ward sister, and then went into specialist practice in around 2003 and really concentrated on bladder dysfunction, bladder cancer, recurrent UTIs and men's health issues as well, and sort of built up independent clinics. So since then, it's been a bit of a love affair, to be honest. And of course, now I'm a serving trustee for the British Association of Urology Nurses, but I'm really interested in highlighting all the areas that come along with urology.
Thank you. So I'm definitely talking to the right person here today, Helen. But can you just tell me though, I'm sure there's some people listening and thinking, I'm not entirely sure what the word urology means. Can you just explain that to us?
Yes, of course. So it refers to the urogenital system. So these are the parts of your body responsible for the production of urine, storing it and discharging it to the outside. So that's the kidneys, the bladder and the urethra, the pipe that leads to the outside. And also the parts of the body in men involved in sexual functions, such as the prostate, which we hear a lot about these days, and the penis and the testicles. And of course, urological conditions include some of the most common serious diseases really in the UK, such as prostate cancer, kidney damage, incontinence, which I think we'll probably touch on, and also bladder cancer, testicular cancer, but also recurrent infections, kidney stones. So very, very wide reaching. And the other thing, Kathy, to note is that 1 in 2 of us will experience a urology condition in our lifetime.
Definitely an important topic for us to cover. Helen, let's kick things off by debunking some myths though around urology. So can you help us dispel some of these misconceptions? So the first one is this: urology only affects older men. Helen, can you debunk that myth for us and shed some light on how actually it's relevant not just to men and certainly not just to old men?
Certainly, absolutely. Well, we can take, first of all, a common condition that as women we're very, very, very familiar with, and that is the nasty UTI, the urinary tract infection. Women will, at least 50% of us, I reckon more 60, will have a single urinary tract infection in their lifetime. And of those, 20% will go on to have another one. 30% of those will go on to have yet another one, so that's recurrent UTI, and 80% will go on to have much more frequent than that. So that's a hell of a lot of women having a hell of a lot of infection, and we're talking about, teenagers right through all the way to perimenopause, menopause, and beyond. So it can span the lifetime. And of course, this is associated with pelvic pain, discomfort, misery, often time off work. And for men too, less frequent, but and often more complex with men, because it's usually to do with the prostate, blocking the drainage of the bladder. But it also leads to very miserable symptoms. And then obviously men in their 20s and their 30s, this age group, we think of testicular cancer. Now this cancer, although it's a very good outcomes if caught early, we can't really dismiss the fact that incidents have gone up 27% since, the 1990s. And the peak ages are 30 to 34, but it doesn't start to really significantly go down until you're 49. So I think we do assume, very young lads, that in actual fact, all men of all ages can get testicular cancer. And, there's other things such as fertility, male infertility, prostatitis, that kind of thing. And I think by understanding this wider scope, I think employers can start to realise that their people can be affected by many of these issues.
And it's interesting, isn't it, that there is a lot more conversation now around prostate cancer, but still not as much as breast cancer, and the awareness is not as great, and yet it's just as important.
Absolutely. And I think just for the first time, not in the UK, but in England, I think prostate cancer just edged breast cancer just before COVID there. So it'll be interesting to see, because we get our figures a couple of years behind, don't we, Kathy? So it'll be interesting to see what COVID did to that, because of course for men and women, well, all genders really missed a lot of diagnosis during that time, so it's a concern.
Yeah, both very important topics. Helen, I'm going to give you another myth that I'd like you to discuss. Toilet habits, bathroom habits are not appropriate to talk about at work. How would you respond to that?
Well, you know that I'm going to push back on that, Kathy. I think that living with the urological disease really does impact everyday life for sufferers, and this covers work, study. If you're a student, socialising, relationships, emotional confidence, and well-being. There's a lot of stigma from being diagnosed with a cancer. Certainly, continence, bladder issues, are really significant. I think we'll probably go on to talk about that. Male infertility, people often feel embarrassed and ashamed. And I think that really, if we're looking at equity, diversity and inclusion, we've got to think about not only, we're all working longer, and this will continue because a lot of older people are working beyond retirement. And it's not just, it's prevalent in the older people, continence. People are working later. And I think that what we need to be able to think about is toilet facilities, raising awareness around incontinence. People spend 60% of their waking hours at work, and basically 82% of working people who had bladder issues struggled with incontinence at work, and 50% actually report that they took sick time to deal with their symptoms rather than and to make something up because they didn't want to say I'm off because I'm struggling to cope with my symptoms. And I think that obviously we've got to think about dignity and creating an area without stigma so that people can come to work and feel included in the workforce. And as I say, it's not just the older people, it's younger people who may have stomas or who use medical devices. So I think it's really important, and I think employers do have a duty of care to accommodate and try to destigmatize these conversations, and really just appreciating the value of having that open culture and try to demystify it, really.
Thank you. So really what you're saying is that everybody pees, let's talk about it.
absolutely everybody pees. And I think that, there's easy things you can do. I mean, as employers, there's awareness days. There's don't include that. Have posters up, have information on notice boards highlighting symptoms and how to access help. I mean, we've all seen some of the signage on the back of toilets, with QR codes, just to point people in the right direction. And I think as well, in my career, what I've seen is, and actually have had to do, is write letters for patients to take to their supervisors at work to explain that they need toilet breaks, and that they will need time away from their workstations. Well, surely we don't want to live in that kind of society where people have to ask permission to go to the loo, and that's going to drive a lot of people out of businesses. And I think raising awareness about incontinence does help employees, educate your HR staff to understand some of the issues. And, at the end of the day, an employee should hopefully be able to go to somebody to say, look, I need to have some time off, and this is the reason why. Because otherwise, you're not going to really get your best out of your employees. It's important for people to attend appointments because this stops flare-ups of different conditions. So yeah, absolutely, we all have to pay. So look at your toilet facilities and look at, maybe make it custom and practice to have comfort breaks during meetings, so that people can plan their bladder management around a busy day and still contribute.
That's a really good idea, because sometimes it's really off-putting if you've got a full agenda in front of you and you're not quite sure at which point you're allowed to go to the loo. I think that would be really useful as well.
Yeah.
And improving the conversation. I think you're right, Helen, and your enthusiasm certainly makes that real. Helen, given your experience, can you share your experience, an example of somebody that you've treated whose urology or bladder issue was impacting their work?
I do have somebody that stands out really, really strongly in my memory from a few years back, and actually very much in keeping with what we've just said. She couldn't be honest with her supervisor. She was in her early 40s. She had passed blood in her urine, and had been checked for a urinary tract infection by a doctor, but continued to really feel very, very ill. So she was referred to the hospital and she had all her investigations. And she was she was found to have a very superficial bladder tumour, which is usually dealt with by just cutting it away in observation. But she was put on a course of bladder installations, and actually it's BCG, which is the TB vaccine. But it's really very good at curing some superficial cancers. But unfortunately, in her case, it created terrible cystitis, which it can do. So she was off a lot, and she didn't know quite how to say that it was her bladder. She tried to go to work, and she had to go to the loo every 10 minutes. Every time people were starting to notice, she was embarrassed. So eventually, she went off sick till she finished her treatment, and then the symptoms came back. She was getting pressured from work to come back because she'd gone way over, there was a very strict sickness policy. And she missed, because she felt like she ought to be back at work, she missed a very important examination of her bladder. And then what unfortunately happened, which I'm sure you've come across in your clinical career as well, Kathy, is that sometimes you get lost to follow up. So because she didn't come for that one, the next one wasn't put in. So when her symptoms returned, she went back to the hospital. Unfortunately, her tumour had accelerated and had come to the stage where she needed to have her bladder removed. So we had that conversation around, the embarrassment. So basically, if she'd been seen earlier, that might have been headed off. I mean, she did go on to recover, and she still thrives to this day. However, she might not have lost her bladder.
That's quite a
perfect
daunting
example of not being feeling like she can't take that time off work. So,
Yeah,
I mean, she really stays in my memory.
That's a pertinent lesson, Helen.
Yeah.
Thank you. Good story. We're going to move on to our quick fire round. So this is quite a short section, so you have to be quick, Helen. What would you say are the three
All
top?
right.
What would you say are the three top urology issues impacting employees today?
So I would say for people at work, I would definitely say continence, male and female, overactive bladder, underactive bladder, post-delivery of childbirth, menopausal and beyond. There's about 3 million adults struggle with bladder control in this country, according to the Urology Foundation. That's a lot of people. So I would say continence. And if you think about all those people trying to dispose pads at work, because not everybody can work at home. And my lady that I've just been discussing, that in those days she couldn't do that. There was no hybrid working. So definitely continence. So we haven't got to shy away from pee or poo, by the way, but we're concentrating on the bladder today. Number 2, I would say, is prostate cancer and prostate health. Prostate cancer, we were discussing earlier, now accounts for about 26% of all new cancers in men in the UK, making it the most common form of cancer in men. Men of Afro-Caribbean descent are 1 in 4 more likely to have prostate cancer. Men are UK white British men are 1 in 8. So black men have twice as likely diagnosis of prostate cancer. And it's not really known that. I think it's becoming known because of the work that Prostate Cancer UK has done. But I think that as employers really need to get that message out to their workers to get that information, to empower and educate. So I'd say definitely prostate. Then, of course, prostate, which doesn't have to be cancer, but can be enlarged prostate, what we call benign prostatic hyperplasia, can account for lots of urinary symptoms in men. And that's a hell of a lot of enlarged prostates in this country. And then I would say urinary tract infection, based on what we were talking about before. The average age of people affected by chronic cystitis, so another term for that is either bladder pain or interstitial cystitis, is age 40, and men can get that as well, but it's mostly women. 50% of women, as we've said, will have at least one UTI, and 1 out of about, I think it's 2,000 healthy men will have a UTI. So this is, I think, a big problem. So continence, prostate, infection. Those are my top 3.
And that illustrates perfectly how it affects everybody, and all employees are affected in the topics. What do you think HR professionals should be doing? How can they make it a priority?
I think it's important for them to know the issues. So, this is a change because in the past, it has been a personal issue. Let's not delve there, but things are changing because people are at work and we have to look after our people. And so I think, see where your gaps are, educate your key people in what are the issues. Maybe even, look at what toilet facilities you have. I know this is really difficult when you have people working off site. But what tends to happen is people tend to limit their fluids, and then that leads to other problems. So, look at what toilet facilities you have, look at how inclusive they are. And a big one for me is the disposal of pads and, devices, so that people can do that with dignity and they're not having to take them home in a carrier bag, or, all of these things that you hear such awful stories about. That, having awareness of those basic human needs, that what goes in has to come out somewhere. And often people with bladder issues have to say to themselves, I'll have to go every 2 hours. I will make sure I go every 2 hours to preempt any problems. So if you see people disappearing, make it your business to try and find out and make that experience a little bit more comfortable and dignified for your workforce. So definitely find out, and maybe use, use the charities, use awareness days. That opens it all up, because if it's not you suffering, you maybe know somebody who is, and it kind of opens up that conversation. That's really what I would say. And just start small. Think of the obvious things.
Thank you, Helen. And can you share a story with us, perhaps where employer support has made a real difference? So an example of where urology in the workplace has been addressed?
So a few years ago, there was concern around the blood in the urine, because I think a lot of people might think, oh, I've seen it once, I'll wait to see if it happens again. And of course, our advice as clinicians would be, if you see it once, you go. But I think people always err on it was a one-off. So what happened was, this was really well supported. So of course I'm based in the Northeast, and at this time it was around about, I think it was around about 2014, the Be Clear on Cancer campaign did a really good, clear campaign on blood in your pee. So the signage was in restrooms, notice boards, and a lot of the companies who took part in that found a big uptake, and it was very, very successful. So the message was, if you notice it once, see a doctor. I think the point of it really was to get people used to using pee, everyday language, in a way what we're doing today, Kathy, to say, it needs to be discussed. And so it kind of got that message out. And it was very, very successful. There were bladder cancers picked up in the key areas, and people were seen. And I think what came out of it was, they weren't frightened anymore of, they knew what to look for, and the messaging was very clear and unambiguous. And I think when employers get behind things like that, and I mean, you could even, let us find the missing 15,000 men during COVID who weren't diagnosed with prostate cancer. A lot of companies really went out and signposted to those messages. So I think it can be really successful if companies get behind these big campaigns.
And as you say, those campaigns are there to help us to raise awareness and to be used. Those campaigns provide the literature and the materials and the resources for companies to be able to support it. Helen, in this next session, I'm going to present you with a hypothetical scenario. So let's consider this. An employee is struggling with a urology issue, but they're hesitant to discuss it. What's the first step that HR could take to address this? And those of you listening, feel free to share your suggestions as well. Our contact details are in the podcast description.
Yeah, and I think we've kind of touched on this a little bit already. I mean, when I think about that lady I've just discussed and her fear of going, I think that it has to come down to trying to build that culture of openness. So knowing your people and encouraging them to be able to say, look, I'm struggling here. Because you can try and do all you can as employers, but if your employee still doesn't feel like they can come to you, then there's more to be done. So I would say, like I said before, training for your teams, try and know your team. If there's enough discussions and highlighting of issues, then hopefully your team members will feel like they can come forward and ask you. Awareness days, signage that was said before, and links with the charities as we've discussed. But it is a difficult one, because it is drawing attention to what has been hitherto thought of as very personal. But I think all you can do is just start very small with that culture of openness, and make it seem that you can discuss these things. It's no longer to be brushed under the carpet.
And Helen, your enthusiasm and passion for this topic makes it easy to talk about. So thank you for that. Our discussion today has highlighted that we do definitely need to address these issues in the workplace. Urology is relevant to everybody, all genders, all ages. It's a universal issue. As we said at some point, everybody pees. So the challenge is to not just think that this is for older men only and that it's not for the workplace. Workplaces, employers, HR people, they need to recognise, don't they, that this is an issue and that, yes, it is personal. Of course, it is personal, but actually it will impact productivity and well-being at work. And I think you've given us some great tips there for trying to create a supportive environment and also deal with issues which, as you've explained through your case scenario, for example, your person that you talked about, actually leads to better outcomes for the individual and in the workplace. And then our quickfire question round, which you answered so beautifully, highlights the practical strategies that people can use and that organisations can use to contribute to the success for this and getting the conversation going. So, Helen, thank you for your invaluable insights. Is there anything that you'd like to finish with?
I think just the closing message would be that, we're not expecting employers to be experts overnight, but just to keep an open mind of what the range of difficulties your employees will be going through, whether it be male infertility, whether it be a diagnosis of cancer or just managing bladders, to just be aware of awareness days. Invite people in, for example, Prostate Cancer UK have a fleet of people who are more than happy to come to the business or do a podcast and talk about, highlighting the symptoms and the testing debate, this kind of thing. And at the minute, there's a Boys Need Bins campaign, which is going to Parliament via Prostate Cancer UK. And that's something you could get behind, and think about proper discreet storage and disposal in your toilets, and just looking at supporting all your staff, no matter what gender they are.
Helen, thank you. You've given us a great conversation today and some valuable tips. And thank you to everybody who's listening as well for your time. Thank you for joining us today on Pep Talks, Health Matters at Work. If, like us, you love talking all things health and work, then do subscribe, hit the subscribe button, leave a review, spread the word. Your feedback drives our content. And if there's a topic that you'd really like us to cover, then do let us know. Next week, we'll be joined by Lauren Lunnis from BNP Paribas to discuss all things menopause at work in the lead up to World Menopause Day in October. Until then, let's continue making health matter at work.